Something that is vitally important to know that most people don't is vital signs. Today, I am here to demonstrate how to take somebody's vitals. For materials, we are going to need a thermometer, an oximeter, a watch, blood pressure cuff, and then obviously a person. Unfortunately, I don't have these materials with me, but there are pictures and I will explain how to actually obtain them. So how do you actually obtain somebody's vitals? Well, for a thermometer, we all know you have the thermometer, and you can either stick it under the tongue, which would be orally, stick it under the armpit, which would be axillary, or you could stick it elsewhere, and that would be rectally. The most efficient way to get it would be the elsewhere place, and then orally, and then axillary. To get somebody's oxygen and to get somebody's pulse, you would stick an oximeter on their finger. Here you can see that this person's oxygen is 97 and their pulse is 92. To get somebody's blood pressure, you would stick the blood pressure cuff up here on their bicep. First, you have to find their jugular vein, which is right here. You feel for a pulse. You stick it right there, and there is a place on the blood pressure cuff to tell you where to stick it on the vein. You then take it and close the valve all the way, and then pump it up to about 180 to 200. When it's up there, you then let go and listen for a heartbeat real closely with the stethoscope. When you hear the first heartbeat, that's going to be their systolic number, the first number on top. Then you're going to keep hearing heartbeats, and when you hear the last one, that's going to be your diastolic number, the bottom one. So a healthy blood pressure is anywhere from 90 over 60 to 120 over 80. That's going to be your systolic number over your diastolic number. A healthy breathing rate, which would be your respirations, you take a watch time for 1 minute and watch how many times the chest rises. Do not tell the person that you are taking their respiration, otherwise their breathing can change. Do it when you have the oximeter on their finger, have a nice conversation with them, and also count their respirations. Healthy one's going to be 12 to 18 breaths a minute. For pulse, you're going to want 60 to 100. Younger kids like us usually have a higher pulse from 100 to 120. And for temperature, you're going to have anywhere from 97.8 to 99.1. Anything above 99.1 is going to be a low-grade temp. Anything over 100 is going to be a temperature or a fever. And then a healthy oxygen is anywhere from 90 to 100%. Most kids our age have anywhere between 98 to 100. So why is this beneficial? Well, according to fire engineering, which are a whole bunch of ENTs, vital signs are an important component of patient care. They determine which treatment protocols to follow, provide critical information needed to make life-saving decisions, and confirm feedback on treatments performed. So today I talked to you about the materials you need to obtain vitals, how to actually obtain vitals, and why it is important to obtain vitals. Thank you.